Hi, my name is Kendra Houston, and I'm a student at Old Dominion University. And for my final project in health or aspects of aging, I will be discussing elderly depression and how depression affects the elderly maybe a little bit differently than it might affect the younger population. So according to Merriam-Webster.com, the definition of depression is a mood disorder that is marked by varying degrees of sadness, despair, loneliness that is typically accompanied by inactivity, guilt, loss of concentration, social withdrawal, sleep disturbances, and sometimes suicidal tendencies. Depression is one of the most common mental disorders in the United States, and it does not discriminate against the elderly population. So much of the elderly population also deals with depression and as a mental disorder. And although it is most commonly perceived in young people, it is very important that we take depression in the elderly population very seriously because they can suffer more and worse sometimes than the younger population. So we should always monitor and treat depression as we would anybody else, even if it is an elderly person. So like I said, major depression occurs in 1% to 3% of the general elderly population. In addition, 8 to 16% have clinically significant depressive symptoms. Depression can be caused by many reasons. Some of the most common reasons in the elderly population that we see depression is due to loneliness, major life changes, medical diagnosis, stress, the death of loved ones, sleeping problems, lack of exercise, lack of control of their lives. Many times the elderly population is moved from their homes that they're used to, maybe that they lived in for a long time, maybe their husband or wife has passed away, and that can cause some extreme guilt. Maybe they're feeling lonely because they're now isolated in a nursing home and don't get to see their loved ones on a daily basis when they used to. Maybe some health problems have taken over in their life and they feel a little bit out of control, or they're scared of dying. All things like this can cause depression. And a lot of times elderly people don't have the means to exercise as much. They're not as mobile as they once were when they were young. So all of these can lead to the feeling of loneliness, the feeling of depression, and it can become a very serious issue for many elderly people. So social isolation is the biggest sign and symptom to look out for someone who may develop depression. And depression is a life-threatening condition, mental disorder. Depression can lead to suicide. It can lead to harming oneself. It can lead to severe breakdowns. It can lead to your health declining. So it's very a serious diagnosis, and we must take all precautions to ensure that people that do have depression, or the elderly population that do have depression, that we are doing everything we can for them to help minimize depression as much as possible. So, like I said, some signs or symptoms that somebody may have that we can look out for in the elderly population, or the elderly can look out for in themselves, is irritability, worthlessness, being anxious, constantly being sad, unexplained weight gain or weight loss, thoughts of suicide, death, or even attempts of suicide. So depression looks different in everybody. Signs and symptoms may look different in everybody. So it's beneficial to have that talk with the people we care about the most and be honest with ourselves and our primary care physicians to ensure that we're getting the help we need if we do have signs or symptoms of depression. So many people in different cultures experience depression differently. Some may display depression differently. It may look different in everybody. So like I said, as a family member, it's important to watch out for signs and get people the help that they may need. So a study was conducted in nursing homes across the country, finding that elderly depression is more common in nursing homes than any other elderly facility. So like I said earlier, someone may be displaced from their home and put into nursing care because they need that extra care facility, but they don't have their family and friends around often. That could lead to depression. Nursing home facilities, you kind of lose control of your life. You aren't able to cook for yourself. You're not able to give yourself your own medications. Sometimes people aren't even able to go to the bathroom on their own. So kind of a loss of control can lead to depression. So if we have family members in nursing home, it's especially important to go there, take them out on activities. Depression can be lessened when people are active, when they have strong social bonds, and when they kind of feel like they may have a little bit control of their life. So I interviewed my grandmother, who is 76 years of age, and to get a better insight on depression and why it may be common amongst the older generation and how to prevent it and how she copes with feeling lonely or sad. She does live in a senior apartment facility for the elderly, and she is able to make a lot of strong connections within her building. And she stated that many times loneliness for elderly people comes from, your family members have died, or your loved one has died, or your pets have died, and that can be sad and lonely. She brought up specifically the COVID-19 pandemic and how she was not able to leave her home because of how severe the pandemic was and how elderly were more at risk for getting more sick and dying. So she was very isolated. She couldn't leave her home for months at a time. She had to have her groceries delivered. She wasn't able to see her friends in the facility. The facility didn't allow anybody to come in, and limited the amount of people that could go out. So she felt during the COVID-19 pandemic that many elderly people had experienced depression and loneliness because of the constant worry of contracting the virus and how they would deal with it if they did contract it. So keeping isolated was the safest for their health, but maybe it wasn't the safest for their mental health. So some things that she does to reduce depression is she builds strong social connections. She has a dog that she cares for. She tries to keep herself busy. She crafts, she gardens, she walks her dog often. She tries to do things that bring her a sense of happiness, so that way depression doesn't set in as much. And she said a lot of the people around her that she know that are elder and maybe suffer from depression or loneliness do the same things. Try to stay busy, try to stay exercised, and really build on those social connections. It's very important if an elderly person has depression that they get help from their medical provider. So prolonged or chronic depression can have a devastating impact on your emotional and physical health. Untreated, it could put your life at risk. So medical professionals can improve depression by providing maybe an antidepressant medication if needed, or working with a psychologist to receive counseling that may be needed. By receiving treatment for depression, it can not only improve your mental health, but it can improve your overall health. So to treat depression, it might look like if somebody has signs or symptoms that you know, or maybe you have signs and symptoms that you know, it may look like going to your primary care physician and talking to them, having them do a full physical exam of you to ensure nothing else could be possibly wrong that would be contributing to the depression. So once that's conducted and, so you take care of the medical side of it, your primary care physician may refer you to a psychologist so you are able to receive some therapy. So there's some antidepressants that psychologists can give you to treat depression. So with any medications, there are side effects. And a lot of times in the elder population, they don't like to add another medication onto the list of medications they're already taking. And if they do add an antidepressant on, they need to make sure it's balanced with all the other medications they're taking. So consulting with the pharmacist about what medications can be mixed, what medications can't be mixed. It's always a good idea to get all your prescriptions at the same pharmacy, so that way the pharmacist can ensure you're not coming up on something like an overdose or mixing the wrong medications that could cause you grave illness. So antidepressants isn't always the answer. It's also possible to just receive therapy, just psychological therapy. This can be beneficial as it can help you develop new ways of thinking, behaving, develop new habits, and reduce the feelings of depression. Sometimes therapists can help you talk out your problems, help you talk out relationships, maybe not make you feel as lonely, maybe help you to come up with ways to develop new social connections, because as we've said many a time, social connections can be one of the biggest assets to preventing depression. So there's some other therapies, complementary therapies, are therapies such as yoga, exercising, or maybe changing your diet. So all of these things can keep you busy, keep you exercise, keep you healthy, which can reduce the chance of you getting depression. Another way is ECT, which is electro-inclusive therapy. It's a brain stimulation which involves activating the brain directly with electricity, magnets, or implants. So this type of therapy is typically used for people that have severe depression, and it can have long-lasting side effects such as memory loss or forgetfulness, which again, a lot of times the older population doesn't want to have even more memory loss than they already do. So this may not be an option, but it is known to be the fastest way to cure depression and to help you feel better almost instantly. So it's important, like I said, for family members to watch out for signs and symptoms of depression. It's important to have a team behind your back. If you start feeling signs or symptoms of depression, consult with your primary care doctor, consult with your family. If you live in a facility, contact somebody in your facility that may be able to help you. It's important to build those strong social connections. So let your family and friends know how you're feeling and get help if necessary. All these things can help us to improve the mental health of the elder, because although they are getting older, it is still very important that we secure their mental health for as long as we can and help them to live a happy and healthy life until their life is over. Thank you.